Some couples will come to us after trying unsuccessfully for a few cycles in conceiving, and we will try and do a fertility evaluation to help them find out what are the reasons for them unable to conceive.
Hello everyone, thanks for joining our latest episode of AskMeDoctor, a health video series for you and your family. I'm 𝗀𝗲𝗃𝗲 from 𝗪𝗲𝗃𝗃𝗀𝗃. Having a baby seems like one of the most natural things, and when you start seeing babies everywhere, the last thing you expect is how difficult it can get to actually conceive one. So today we have Dr. Natasha, a fertility specialist who found her passion in assisting couples to conceive. So welcome to the show, Dr. Natasha.
Hi Eliza, thanks for having me on this show. I'm so excited to be here.
Alright, so doctor, can you share with us on what is a fertility evaluation? Like, I'm actually very curious what it is because, you know, what kind of evaluations do you actually do?
A fertility evaluation is basically an investigation that we do in order to try to find out what are the factors that may be hindering couples from conceiving. Some couples will come to us after trying unsuccessfully for a few cycles in conceiving, and we will try and do a fertility evaluation to help them find out what are the reasons for them unable to conceive. So we perhaps will be able to give them some fertility treatment which may consist of fertility treatments such as IUI or IVF, or maybe it will be as simple as helping them conceive naturally.
I see.
We will investigate what's the reason for them unable to conceive, then we'll find out maybe what are the factors which is hindering them, then we'll proceed with the appropriate treatment.
Okay, that's actually very interesting. Like, so there's a few different treatments, right? So doctor, I do have a question. What can couples expect when it comes to going for a fertility evaluation?
You would expect to have several things happening during the fertility evaluation. Firstly, we'll start off with the history. From the history, we'll be able to assess whether there are any factors that may cause you to have any issues in conceiving.
Right.
We will be assessing for both partners, basically, for your lifestyle factors, for your weight, any health issues, and these factors may be causing issues in having you unable to conceive.
I see. I didn't know that there's a lot of factors that actually can, affect to any couples who are trying to conceive.
Yeah, there'll be lots of factors to be considering. So we start off firstly a very simple history assessing all this. So we'll be able to identify any obvious factors, and then we'll further evaluate with a list of investigations after the history.
Okay, so it's like a little bit of a CSI kind of investigation before we jump into why and finding out the problem of why you can't conceive.
Yes.
Okay, that was actually very interesting. Would you be able to elaborate on what the procedures that these couples will go through when going for a fertility evaluation?
For fertility evaluation, some of the basic investigation that a couple may be undergoing, we'll start off with the female partner first. The female partner, I will ask them to do a blood test. Now, the blood test will consist of full blood count, screening for infectious disease, and also to check for their ovarian reserve. So that blood test is called an AMH. After the blood test, we'll be doing a ultrasound test. And majority of the time this will involve a vaginal scanning. So it may be uncomfortable, but just relax, you'll be alright, and we'll do the vaginal scanning basically from below. So means the scanning will be inserted through your vagina. So don't worry, we'll make you as comfortable as possible and be very quick. Now when I do a vaginal scan, I'll be assessing basically your reproductive organs, and that is your uterus, your ovaries, and to have a look whether there's any fibroids, there's any cysts, anything else that may cause you to have issues in conceiving.
I see. Okay, so ladies first, right? When it comes to checking with all the history.
But we won't forget about the men.
What about the men? Like, what kind of procedures do they go through next?
Right, we won't forget about the men because usually we would investigate both at the same time. So the man will also have to undergo a blood test, which is the same thing. We'll do a screening for infectious disease. We'll take their full blood count. And the next thing, the most important for male partner, is to have a semen analysis. A semen analysis where we check their sperms. That will be involving them coming up to the clinic and to actually produce the sperm in the clinic. But obviously don't worry, I mean, if it's daunting for a lot of men out there, we have means and ways to make it a bit easier. And the semen sample will be sent off to our lab, and the results will be back out in about 1 hour's time.
Okay, that's actually very fast.
Yeah, 1 hour, 2 hours, but yeah, we'll be ready to go through the results of the sperm test. And basically, within the sperm test, we are looking at the sperm count, the movement, or what we call the motility of the sperms,
Alright.
and the quality of the sperm. And that will help tell us whether there are any issues with the sperm that's causing the couple to have issues in conceiving.
Okay. So I guess it's safe to say that when it comes to conceiving, it's not fully on dependent on the females, but it's also a male. It's a
Misconception.
Misconception, yes.
Yeah, but we're having lots of public awareness now that we now know more and more that it takes two to make a baby.
Yep,
so
definitely
we
it takes
could,
two.
yeah, it takes two. So we'll have to investigate both of them. We do have issues where husbands are a bit reluctant to do their sperm test, but it's all right. We'll start off with the female first, and once everything's done, we'll then get on to the male partner. And it only involves a blood test and a sperm test.
So doctor, what can couples expect after doing the fertility evaluation?
So after we've done the fertility evaluation, then we'll be able to have some idea what are the possible reasons that the couple are unable to get pregnant. So it can be as simple, the treatment can be as simple as tracking the ovulation.
Oh,
yes.
Tracking the ovulation?
Yes,
I think I've actually used Clearblue's digital ovulation test.
Yes,
and
correct.
I love how cute it is when you're fertile. It actually comes up with a smiley face.
Yes, exactly. So when we assist patient and we tell them that you can actually track your ovulation, because some patients, even though they have a regular cycle, they may be ovulating either earlier or later. So what this ovulation test does, it helps track down the best 2 days of the month in order for them to do the baby dance to conceive faster.
Alright. Actually, that's very good to know. I'm aware of it, so I've actually been using Clearblue.
Great.
In my family planning, so it actually helped a lot when it comes to trying to conceive.
So we do use it also quite commonly in the clinic, and lots of successful pregnancies as well.
Okay, I do have one last question to ask. When would be the best time for couples to go for a fertility evaluation?
Alright, very important questions. Actually, if you are trying to conceive, you can come at any time. But the general advice is, if you are less than 35 years old, you have a regular cycle, you can come and see us after 1 year of trying. But if you are more than 35 years old and you have irregular period, or you do know that you have some gynecological issues such as fibroids, endometriosis, you can come and see a doctor after 6 months of trying. But saying that it's just a general rule. If you are very concerned, anytime, just come. You can even come before you get pregnant, because then we'll be able to assess you and give you the appropriate advice.
Alright. Okay, that's actually very good to know. So thank you so much for reassuring me and the audience out there on when would be the best time to actually go.
No general rule. Come in whenever you feel you are concerned, have any concern. We'll do the fertility evaluation.
Alright. Thank you so much, Dr. Natasha, for your insights in preparing couples for a fertility evaluation. And special thanks to Clearblue for sponsoring this episode of Ask Me Doctor. At Clearblue, we put women at the heart of everything we do to empower and transform the way women manage their reproductive health. We hope you enjoyed and learned from today's program, so stay tuned for our next episode of Ask Me Doctor for more health tips for the family. Thank you so much for watching, and we'll see you again next time. I'm 𝗀𝗲𝗃𝗲.
And I'm Dr. Natasha Noor.
And this is motherhood.com.my.
Bye!
Find your fertile days with Clearblue ovulation tests.